A 2014 Michigan State University study links the emotional and psychological abuse of pregnant women to trauma symptoms in children during their first year, such as nightmares and avoidance of physical contact. This study surveyed 182 mothers aged 18 to 34, focusing on verbal and psychological traumas during pregnancy, showing a correlation between prenatal abuse and emotional problems in newborns. Prenatal abuse impacts the mother's stress response systems, potentially elevating cortisol levels in the unborn child, affecting their brain development. Many victims underestimate the impact of abuse on their children, not recognizing the immediate effects on newborns. The high PTSD rates in domestic violence victims, exacerbated by lack of support from supposed protectors. Domestic violence, occurring in what should be a safe environment, stressing its severe impact on children. The study underscores the urgency for healthcare professionals to aid pregnant mothers early, potentially changing the child's developmental trajectory and improving maternal health. The National Health Service study of 489 women shows psychological trauma during pregnancy, like threats or insults, leads to adverse effects post-birth, including issues in auditory development in newborns. Research indicates that the fetal auditory system develops significantly around mid-pregnancy, responding to various sounds, including parental arguments, which can increase stress and hinder auditory development. The findings suggest that verbal abuse during pregnancy can trigger increased heart rates in both the fetus and the mother, potentially stunting the child's auditory development. Brain imaging from infants exposed to domestic violence shows reduced developmental areas, suggesting significant structural changes due to non-physical abuse. Experts recommend avoiding verbal abuse and loud noises during pregnancy to protect the newborn's auditory functions and overall development. Due to the sensitive nature of the subject, many mothers did not fully report their experiences, and the studies relied on self-reported data, which may not accurately capture the frequency or severity of abuse. Additional factors such as family history of hearing loss or use of ototoxic medicine were considered to differentiate between hereditary and abuse-related health issues in children. There's a recognized need for improved detection and prevention of all forms of domestic violence, ensuring better treatment and support for abuse survivors and their children across various systems. Domestic violence impacts are now being more widely studied, revealing that non-physical abuse can have a profound effect on both mothers and children, sometimes more so than physical violence. The Japan Environmental and Children's Study further explores the impact of verbal and emotional abuse during pregnancy, showing a significant portion of pregnant women experience this abuse, with greater prevalence in socially disadvantaged groups. Increasing research and awareness are crucial in addressing and mitigating the impacts of psychological and verbal abuse during pregnancy, highlighting the need for comprehensive care and protective measures in healthcare settings. Be sure to stay in a safe environment during pregnancy and avoid situations that might trigger emotional abuse. Thanks for watching.